Can mild symptoms still indicate cystic fibrosis? Have you ever wondered if mild symptoms could point to cystic fibrosis? The answer is yes. Mild symptoms can indeed indicate cystic fibrosis, especially in cases known as atypical or mild cystic fibrosis. This form of cystic fibrosis may show symptoms that are less severe or only affect certain organs, which can make diagnosis more challenging. Cystic fibrosis is a genetic condition that primarily impacts the lungs and digestive system. It causes thick, sticky mucus to build up in these areas. Classic symptoms of cystic fibrosis include a persistent cough that produces mucus, wheezing, frequent lung and sinus infections, poor growth, and various digestive problems. However, in cases of mild or atypical cystic fibrosis, symptoms can be less obvious or may occur sporadically. Some of these milder symptoms can include a chronic cough, wheezing, and frequent lung infections. Individuals may also experience sinusitis, nasal polyps, pancreatitis, digestive issues like diarrhea, and slower growth or unexplained weight loss. Interestingly, some people with mild cystic fibrosis may only have symptoms affecting one lung or may not show the full range of classic symptoms. Mild cystic fibrosis can sometimes go undiagnosed for years. This is because its symptoms can overlap with other common respiratory or digestive conditions. Adults or older children may be diagnosed with atypical cystic fibrosis after experiencing recurrent respiratory infections, chronic sinus issues, or digestive problems that do not respond well to standard treatments. Due to the subtle nature of these symptoms, healthcare providers might initially attribute them to other causes. This is why it is essential to seek medical evaluation and appropriate testing if cystic fibrosis is suspected. Diagnostic tools such as newborn screening, sweat chloride testing, and genetic testing are crucial for confirming cystic fibrosis. The sweat test, which measures salt levels in sweat, often shows elevated salt levels even in mild cases. This is a key diagnostic indicator. Treatment for mild cystic fibrosis generally follows the same principles as for classic cystic fibrosis. This includes airway clearance techniques, medications to manage infections and inflammation, and nutritional support. In summary, mild symptoms can indeed indicate cystic fibrosis, particularly in atypical cases where symptoms are less severe or intermittent. Being aware of these milder presentations is important for timely diagnosis and management. This can significantly improve quality of life and health outcomes. If you or someone you know is experiencing persistent respiratory or digestive symptoms that suggest cystic fibrosis, it is important to seek evaluation from a healthcare professional who is knowledgeable about this condition.